I want to name in this process is how touched I am by just um, your showing up here and being present for this process, and that parts of me just feel tender with your company. And so your questions will be welcome at any point in this podcast. And we can dive in as much to internal planning systems and the framework and structure as the group is interested in. We can also dive into psychedelics, and I have a background in plant medicines and in ketamine, and have worked with organizations that were doing pilot programs for microdosing ketamine, and then journey work with it as well. And so I generally do the forward-facing public sharing of ketamine because of its legal status, and happy to give any insight that I may on the plant medicines as well. And I'm sure that is ways to go on that. And I think of Michael as really being grounded in the internal family systems approach, and therefore the self energy and the ability to just help demo that quality of internal family systems. So we'll be kind of bouncing back and forth. And do you want to introduce yourself?
Sure. Michael Crespi. I live up and raised family in New Sharon, Maine, and yeah, um, very trained in sort of the matrix of typical mental health approach. And when I discovered IFS, it really became my holy grail as an extraordinary way of helping people remove the obstacles that are in the way of their fullest expression of life. And it was such a wonderful game changer for effectiveness, and not only as effectiveness in the so-called healing journey, but really in allowing people to really discover and utilize their wing capacity. And I like to say that the goal isn't healing. The goal is to deliver your gifts into this life, and whatever the healing aspect of that is, about transmuting, not getting rid of, but transmuting the obstacles on the runway. And so it's been beautiful for me to do this. But every time I do it, I'm getting that many hours of my own counseling. Wonderful benefit. Yeah. How many here feel like they have a somewhat of a informed IFS knowledge, I should say? Yeah. And maybe just so I can see who's really just not aware much at all. Yeah. Great. Yeah, so for me, it's now just debating where to start this.
Let's just start with some basics of the system for any people that don't know, and other people can fill in that already do know. But basically, it's comprised of, I think of it as three main parts, which are the protectors, the exile, and the self. And so the way this system works is it says that we have parts of us. We're not a mono mind. So Christianity, the Western worldview, says there's a single self, or I'm just comprised of, me. But the IFS lens and obviously a lot of other mystical lenses say that we're comprised of multiple selves. And any of us who have had an argument inside our own head are aware of that.
Let's see a show of hands. Anybody had an argument like this? Okay. So, and I'll give maybe a visual metaphor for this. Has anybody not seen when 10,000 starlings are flying 50 miles an hour and doing these incredible acrobatics, and here they are, wingtip to wingtip, nobody's hitting each other? So, what is the innate wisdom that is allowing communication to happen all but instantly and allowing that coherence of the many parts being one? Um, so, that is my metaphor for internal family systems. That unifying wisdom is what we call capital S self. I like to say source and put any word in there that works for you. And so imagine that that has an extraordinary coherence. And as metaphor, when there is a big T trauma, little T trauma, young in age, or even going back ancestry, because these things get forward. Um, so when something happens, the metaphor, imagine all those birds are one of your parts. And they're real. We don't know what, it's a mystery, but they're real. It's not a metaphor. So imagine a part is summoned in a way to attend to a wound. That wound we call the exile. And the names given to this are exactly what they do once you get the meaning. So the exile is an initial wound of a child, and or later, and that the child cannot exist in that the energy of that wound and be basically socially or attachment safe with the family system around the parents, especially the guardian. So it needs to do something to stop that wound from continually emoting. And that's the role of a manager protector. Manager, now let's just imagine the manager is one of those parts in the flock. It peels off the flock to go attend to that wounded child with a strategy to keep that wound concealed and keep it from being further exposed. Anybody ever been in a relationship where one person or the other at some point sabotages the relationship? That's almost as many as the other. And that's an example, say, of an initial wound being intimacy is not safe. It could be very simple. It could be a 2-year-old getting screamed at by an overwhelmed mother or father. And
I might add too that we don't see the wound, we see the trauma.
fair enough, yes.
And
Say
so-
more about that. What do you mean by that?
Well, we see the reaction, we see the protector protecting the wound. So I think Cobra Mate is the one who's credited with saying you don't see the wound.
Right,
We see
right.
the trauma or the protective habits that we've developed to hide the wound. And that's different than allowing the wound to heal.
Right, and that the biggest way maybe we also see that wound is the impact it has on us and the world around us. Yeah. So the manager then has a strategy in the example I gave to keep intimacy away, and it is unconscious, until we make it conscious. And so this work is really about making these parts conscious, making the invisible or the subconscious conscious, so we can then have access to helping. Helping the process of that protection shift in a way that also allows us access to the womb and essentially creating a relationship with the person in the role of reparenting that child, that wounded child, in a way that it wasn't healthily reparented before. And it's an extraordinary process, and it really is effective. So that's two of the parts. A firefighter what does a firefighter do? Puts out fires. So if something happens where the protective strategy of the manager, something either happens so fast or it blows by the manager's capacity, that, the fire alarm rings, the firefighter comes in without concern to the damage it's doing. The firefighter in reality comes into the home, doesn't care about the rugs, doesn't care about smashes a hole in the roof, and that's what often happens when we get into that. A simple example of that might be you come home from your day of work, you have a drink or a beer after work, and it kind of chills out the system. That's like a manager trying to keep the anxiety at a workable to a workable degree. Now let's just imagine, you same job, you got fired. You come home and you're just so dysregulated and you binge drink. Okay, that would be a firefighter trying to put out that extreme stress. And so, kind of like that. Any quick questions so far?
Or additions.
Or additions? Yeah.
I was just gonna add, in sitting with like powerful protectors, part of what's been so compelling to me, my own protectors and protectors of clients, is that so often, like the firefighters seem to have deep ambivalence about the jobs themselves.
Deep what?
Ambivalence
Yes.
about the job themselves.
Yeah.
So like they're kind of forced into these roles that society many times like vilifies. And many of them are like highly stigmatized, especially firefighters.
Right.
But they usually have their own parts, because parts have parts and they feel like ambivalent. And so I was curious if you've had experience with that on your own system or with clients.
Yes. Yes.
Mhm.
Which I think goes really well to another metaphor, which is of a baby bear that's wounded, and you're hiking through the woods and you see this cub that's wounded, and what's the longing is to go up and help it, right? So you go up to help it, and as you're helping it, you look up and Mama Bear's 30 feet away. Well, what's Mama Bear gonna do? Come in and mess you up. And so who's Mama Bear? Mama Bear is one of the protectors. And you didn't get permission to go to the exile of the wounded part. And so I think what you're sharing is Mama Bear doesn't want to attack you.
Yeah.
Mama Bear needed you to get permission in a way that she could understand to provide support.
Yeah, go ahead.
I was just going to ask, so as you're using that example, I'm just trying to track. So as a practitioner supporting, this is, the baby bear is the client, and I'm just mapping to your example. As a practitioner coming in to help, and then all of a sudden the practitioner becomes figural or being a threat. Is that what you're
Well,
saying?
let me respond to that. Not quite.
Okay.
So, well, the skilled practitioner would never attempt to go to the wounded or in exile without complete or without the agreement of the firefighter or the manager. And only until then do you have access to the exile. So does that respond to that?
Yeah.
But it could also be diagnostic as a clinician. If you notice that it's not working, then that your process isn't working. It might be because you're trying to bypass the protector and get straight to the juicy work of the exile. And so then the client might experience you, or you just might see ambivalence, or that you're not able to provide the care that you know is possible.
And that would be something to really avoid. How was that for responding, or ask more?
I don't know. I just, I think it hits just on, in my own system, like having had, healed from really severe addiction earlier on in my life, and then working with a lot of people that have like, really heavily burdened, kind of highly stigmatized protectors, so like protectors, firefighters that show up and, use fentanyl, cut, or, binge and purge, and like our society tends to just really like, vilify those protectors, and they internalize that. But then also many times they have their own. When we really sit with them, it's like so profound for me every single time, because they always end up feeling themselves like they don't want to do what they're doing.
Yeah, that's right.
And so I think it's just, I guess, it's just something that really moves me every time. Is their own ambivalence about the jobs that they've been stuck in.
And that's one of these. So when I'm working with a firefighter or a manager, there's a real negotiation going on. And it's really about building trust and confidence and then the client's self energy, trying to bring self in. But the examples you're bringing are difficult. This isn't going to happen overnight. And it takes a lot more time, with exception, to build that trust of mama bear. And they do it. And one of the navigations with that is, the firefighter does not want this job. It's exhausted, it's tired, it's, so many things. And they'd rather be doing something else. And that's part of, really trying to talk it into, at some point, a better vision of what it could be doing as a goal for the client's first.
Would you say that all our parts fit into these categories? Or, I guess specifically I'm thinking of a child's part that is very like open, playful, and I'm curious if that is like, if you call that self energy or if that's another part, another category.
Beautiful question.
Yeah. Well, I would go back to, well, there's a theme, playful, like I say, childlike playfulness. And the criteria I kind of use, is it self-led or is it a reactive strategy? Example, is it trying to make mom laugh because mom is sad and depressed and that's become its parentified role? And so that would then be some, coming from a wounded place. And then again, if it's free and sort of in that capacity, and joyful exuberance of a child. Yeah.
And so that can bring us to the definition of the self has these certain qualities. And there's something that Dick Schwartz calls the 5 Ps and the 8 Cs. And these are just qualities of self energy. And so one of the 5 Ps is playfulness.
Yeah.
So you're right to automatically associate or sense that that's self energy. And then is it a strategy to get love?
Right.
Or is it an expression of self? And the 5 other P's I can go over: patience, perspective, presence, and then persistence. And so we really want to look for all of those at any given point, because other parts can be like, they look like self, so they can be self-appearing, but they might be missing one of those qualities. So you might have a part of you that is angry, and anger is a real important indicator that a part of you needs to be heard and a boundary needs to be recognized. And there's persistence often with anger. And yet, the self would be able to help even be in relationship, and the self might present even with someone else might experience it as anger because it would be boundary and it would be clear and concise, and to other parts that can look like anger, but then it would also have these qualities of the 8 Cs, of compassion, curiosity, confidence, clarity, courage, connectedness, and calm.
Okay. And it could be other words. This is just what the dude came up with. But I use it as like one of the questions I often get is, how do I know if I'm in self or I'm in a part? And it's basically, if anything's contrary to these descriptors, then you're in a part. But if it's in the same flow, and you're in that place. So I mean, the child can't assess that, but the child. Has anybody ever been in a relationship and you thought, God, that person is acting like a 12-year-old, right? Well, what does that really mean? It means that person is hijacked by a part most likely paralyzed at the time of a 12-year-old into a protective strategy of a 12-year-old, right? And so, even going back to the firefighter question, is so much of this is at the core of so much of the wounding is shame, and so working with these parts to really validate their story, their experience, deepest respect for everything they've been through. Nobody's ever done anything, let me word it the other way around. Anything that's ever, any part strategy that's ever occurred has been done because that part loves you dearly, even if it's getting it such harmful results. So that is really transforms the whole feeling of shame in the process of doing it.
And some other key terms that are worth hitting on is when we get blended with a part.
Yeah.
That's when we start saying things like, you know, I'm angry, blah, 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 blah. And we have this emotional reaction that's we're blended with a part. We're not actually capable in that moment of bringing on the curiosity, the compassion. And so that's an indicator that, at least for me, when I'm just working with myself, to take a breath and come back to center and to create some distance from the part that I'm blended with and try to speak for that part versus from that part. So there's not difference. So speaking for the part would be literally saying there's a part of me that's really angry with the decision you made. And speaking from that part is saying, I'm really fucking angry you did that. And you can feel, I think you can feel the difference in that. And usually, if you're in a relationship, then the other person can feel the difference in that. And so I might use this as a segue into psychedelics because psychedelics are, depending on the psychedelic, ketamine is really good at unblending from parts because it's a dissociative anesthetic. So it's a pain reliever and it disassociates you from your parts and from your physical body. And so large journey doses, you know, can take you into this kind of realm of consciousness that's pain-free. Using it in a microdosing context, you, for example, could use it to unblend from a part. And so from the microdosing protocols I've worked with, they're trying to use it as they're trying to actually have you take it at night so that you sleep through any of the effects of it and are still getting a gentle but unperceived ability to rest back in yourself. If you wanted to use it more specifically to a time that you're triggered to unblend, it certainly has that capacity to work really, really well that way. The caveat, I think, is you risk then using an external stimuli to unblend from a part of you, and then that risks, I believe, an addictive tendency because you're using an external stimuli to become internally resourced.
Just a concept that's been useful for me that I didn't hear, and I want to check it because I don't know if it fits here, but the notion of knowing internally as I'm mapping my own system where things are, right? That navigating capability is a whole, there's a capacity to do that. And then there's when you're merged and you're feeling like you're 12-year-old and you have no capacity. So the term trailhead was the one that I heard that is some kind of signpost that pops up that says, you probably want to look over here, right? And so in terms of knowing when you're blended, knowing when you're not, like, can you say just a little bit about those signposts and how they fit?
Can I do something?
Yeah.
Is there anybody here, as you sort of scan your internal or energetic world, anybody here not feeling any bit of anxiety?
I was until I needed to speak up.
You can't say that.
Right.
So on the other side of that coin is then those who are feeling a bit of anxiety. Anxiety is like a smoke alarm. And what do we typically do with a smoke alarm? Well, not typically. But pull the battery out. There are 8 firefighters in the room. Lots of them. But point being, yeah. But there's so many ways to pull the battery out of the smoke alarm, right? Anything we're calling addictive behaviors or strategies to anesthetize the warning signal that a smoke alarm actually is. It's trying to call our attention that something is not right in the environment and we need to check it out. So here we are, we check it out, anxiety, and when one has some skill around this, you could go inside and identify that as a trailhead, right? Okay, what is that anxiety?
I just wanted to make note, you were speaking of exploring your own like inner workings and mapping that, and I just want to call attention to the sense we have that I think is underappreciated, our proprioception, knowing where our body is, and just the fact that that carries inside you, and in practicing that, things like mindfulness and breath work and all that is I think an extension of that sense.
Yeah, thank you for bringing that in, yeah.
And incredibly instrumental for internal family systems because you're getting you're in touch with the sensation of where the different parts live inside you. Yeah, I guess we're reading that in.
And that leads into another addition to that is we start a session more or less with where are you feeling it inside, outside your body, or both? Because in the mystery of it all, that seems to be the way I put words to it is these parts are real and they occupy energetic places in our body, literally. And so we want to find out where they are and then begin, in the sense of a trailhead, to create a connection with them so that we can communicate cognitively with them and do this work. Have an avenue to do the work. Is that helpful?
Yeah. Okay. So then I'm thinking of the other plant medicines that are generally non-specific amplifiers, meaning they can amplify any of your parts potentially. And my theory is that when we're going through a journey and we're going through the dark night of the soul period, we're really getting to experience a part that's bringing to our attention something it wants to work through or process. And so ideally there's enough self energy in either the group if you're doing a group journey or with a practitioner that's with you. But the idea is that there's enough self energy for this part that's coming into more amplification on the psychedelic to go through a process. And if you think about this process is how we live. Our respiration is a process of breathing in oxygen that all other beings on this planet have breathed. Our digestion is a process of, changing food into fuel for our bodies. And likewise, emotions are a process for relieving traumas that we've experienced. And so the importance of having self energy on board is so that we don't create a feedback loop in that process. And especially with emotional parts, we get stuck to a story, and that story just brings us back to the beginning of that process. And so you maybe been able to identify the difference between someone who's grieving or crying, but you can feel that there's, for lack of a better word, a victim mentality that's getting reinforced in that process. So they're not actually able to compost the experience or shit out the experience because of the story that they're reaffirming. And so if the self can come in and that part of them that's reliving the story can get adequately heard, to know that it's not alone, to begin to have a sense of belonging. And in that sense of belonging, then we've also probably experienced people in real grief that allows a cleaning, cleansing. And so, for example, in Zen, they say an open heart is a broken heart. And so any of us who have experienced the real process of grieving know that it is a gift that cleans us out. I like to think of it as like the 100-year flood, where it comes through and it breaks out the log jams and the debris that's all piled up and cleans us out, and we're open. And in a way, we're also more vulnerable because we might not be used to this level of openness. And so, again, that's where community and belonging and a willingness to be tender with ourselves becomes the way that we begin to integrate living a more open existence.
Thoughts? Any questions so far? Anybody want to check us with?
I'm curious how you go about mapping. Is it sort of like watching what arises in the moment, or do you ask people to kind of do a self-inventory and
Yeah, well,
share a little bit about that?
yeah, sure. Well, when I'm seeing somebody for the first time, just sort of getting a lay of the land in the internal world, what's up, what are their concerns, why are they coming to this, or in your world, maybe more why they're doing the journey to begin with. And I'm there just starting to map. I'm pretty good at just taking a dialogue and say, okay, there's this part, and it's a teaching. So I like to say, you can call what I do therapy, you can call it counseling. I prefer to call it training. And it's really like, how do you do human better? Because we're not talking about it. And it's yeah, and so once they have a sense, starting to get a sense of what these things called parks look like, feel like, yeah, then see me for an hour a week or an hour every other week now. Go home and you'll start to begin to identify, I'm anxious, that's a part. Okay, let's look in. If I have a reaction to something somebody said or the news or whatever it looks like, okay? There's what is maybe a expected normal response to something, and then there's something that's way more than that, right? And that's something that's a part's reaction from the past. Another piece just to add is when Daniel was talking about what can come up about grieving, we carry the grieving of all the unresolved grieving of our ancestors. Mm-hmm. And I would suggest that most of our culture has no idea that it's carrying all this 1,000-pound gorilla on its shoulders. So this work is also very potent at resolving that in your life and also in the lives of the history, which, yeah.
Well, I was just going to say.
Absolutely.
Well, I had a question. You said there's a normal reaction of anxiety, and then there's a normal reaction of anxiety to certain things, and then there's beyond that. With what's going on in the world, global warming and threats that are really big.
Yeah.
What is that, and how do you draw that line between anxiety? What's the normal reaction to something that's really big?
Mm-hmm. Horrifically big. Yeah.
Yeah.
Well, it's an investigation. So I see myself as sort of a professional interviewer. And going in and just, interviewing, like say you, and yeah, I mean, all this past winter, I felt a lot more the weight of the world. And I could feel that weight. And example, my Jewish side of the family went through the Inquisition in the late 1400s, 1500s. I also carry that weight. And I've done a lot of work around that ancestrally. And significantly unburdening that unresolved grief that in some mysterious way I was born carrying. Okay, it doesn't mean that the extraordinary, global disasters, whatever, isn't there. But you're going to be much more self-led to be able to respond to it rather than react to it. Respond and react. And you're still going to have the burden of these extraordinary things, but more self capacity, more internal capacity to respond to it rather than get shut down.
I'm curious if there's more that you wanted to share about your specific experience with the anxiety.
Well, there's just the internal work, but then I try to, work through that anxiety, but actually maybe I should be anxious. It's a rational thing to be anxious about these things.
So there's a part of you that says, I shouldn't let go of this anxiety because the risks are real.
Yeah.
Yeah. So first of all, I look at anxiety as an extraordinary, important gift, and all the ways we go to anesthetize it is really not the right way. Once again, it goes back to yes, you have the anxiety around it. Don't want to get rid of anxiety. Anxiety is the messenger of the part trying to get our attention. You don't want to get rid of it. You don't want to pull the battery out of smoke on. And you want to, the analogy's on there too. But, you want to work with the fire burden that doesn't belong in your particular life. And so that makes the fire a lot more workable. Doesn't mean it's a solution, but it makes either the fire more workable or your capacity to still be a miraculous human being in relationship with whatever's going on. Did you yes, you did. And then there was a movie.
Kind of, it wasn't really a fully formed thought, but it was in general about the idea of how it could be helpful or not helpful in terms of conceptualizing ourselves as parts versus as well, it's unformed. But I guess the process is having the parts be able to communicate with each other and mediated somehow by the self, basically.
Yeah.
Right, through the whole process of whatever this is what it is, we're unified. Essentially our parts are getting to know ourselves, all these feelings, these emotions, and what are they attached to? Are they attached to, memories from the past? Are they low catastrophe? Sort of like integrating ourselves, right?
Yeah.
And when the parts stop being in conflict with each other, but in dialogue, you also have an experience of more self emerging.
Mm-hmm.
Whereas when they're in conflict, I tend to just experience the parts blended with that.
The smoke blowing on.
Right. And I just wanted to add too, like, that anxiety, I mean, I think of anxiety as like sort of frozen fear, right? It's sort of anxiety sort of implies that it's not moving, right? It's just kind of hanging out and good sign, but it's not as a thing in itself. It might not, like, until you're aware of it, it's not helpful, right? Basically what you're saying.
Well, right. I mean,
As
understood.
aware.
Imagine a baby in the crib crying and crying with no response.
Yeah.
It's
not very.
Well, it'll shut down at a certain point, or yeah. What do you want to say?
Okay. That's it.
Okay. Yeah.
Yeah, I think what you're saying just highlights that often anxiety points to somewhere that we do need to take action, and that the anxiety will continue to exist in our system if we don't take some kind of action. And that action could either be being with the part that is experiencing the anxiety adequately, but it also might be some external behavior to keep from refueling that anxiety.
Such as.
Well, there's a lot of such as, I know for me, anxiety comes up when I see that I'm not taking action in ways that I need to. I'm delaying taking a action that hasn't taken. So then the anxiety is trying to flag me to take action in a way that has integrity. And then there are usually parts of me that are afraid of the repercussions if I were to take action that way. So then if I give enough attention to those parts, then I can take action, and the anxieties resolve.
Maybe an example is prior to doing this, a bit of performance anxiety, part of mine. As a younger person, it would have been sky high. Now I'm pretty chill about it. But there's still a bit of rumble in there. So before this, I talked to that young boy who was ostracized for using his voice in public and help him feel confident that the adult me, the self-led me, is in authority here and he can be safe and not have to trigger his strategy of being worried about, repercussions or judgments, that kind of thing. So, there's a lot of skills to doing this, and they're very doable and extraordinarily effective.
Let's go back here first.
Michael and Daniel, thank you so much. I was, based on what you said, where you're reassuring that young boy that the adult you, the self-led you, is in charge and will take good care of you. But what is the process of helping those parts first gain trust? Because for so many years you weren't really a great parent to that inner boy.
Yeah.
And so that inner boy doesn't trust you. So how do we help them gain the trust?
Well, that's all the work of doing this. It doesn't happen because I just say so. All the work has been like what we've been describing here, working with the public, identifying them, and there's protocols for how to love them back into connection. To take them out of their paralyzed place in time. Reactive parts tend to be paralyzed sort of at the scene of the crime, at the time of that, and so that's the whole training of how to do this. And so that therefore then I'm in a place of being unblended from the part. Let's just say I didn't have this and I'm feeling anxious. Okay, I come in here and I'm still feeling anxious because I didn't know that there's this part of me. I'm not really anxious. The adult Michael's anxious. It's that young boy getting triggered by things that look, smell, and taste like the original scene of its rejection and the shame that it's. So it's that process the effort I've made to do this work.
Which in IFS might look like a practitioner or yourself feeling into this part, seeing if this part can feel that you are here with it.
Yeah.
Asking the young childlike part how it feels towards you. You might even ask it how old the childlike part. How old do you think I am? Oftentimes it thinks you're the same age as it. So then if you update it, that itself can relieve its fears a little bit because it knows it's now an adult. Because at the time that the wound happened, you didn't have yourself parenting yourself. And so it's lost. It's reliving the experience that it really had. And so you go back there to help it experience that difference with support that it didn't have in the moment. What would you like me to do that wasn't done for you then?
There's like a possible baby steps of demonstrating credibility. Like, I will do this for you, and then stretching that edge more comfort, more that part to feel comfortable. To let go and create more space.
And when it's done, it knows that when the part of you that's lost in that painful experience is done with the experience, it doesn't want to stay there. And so you invite it to come with you to either now or invite it to go wherever it wants to go. And in that process, it can often leave behind the story and exist in the present.
And psychedelics help with this thing of the parts gaining trust in us, like through the process of a journey?
100%. Yeah, they can help a lot in the psycholytic dose. So a smaller dose allows us to still converse, and it might just soften some of the protectors. The warning or admonition with psychedelics for me is that you might just remove mama bear and go into an exile while you're on a psychedelic, and then afterwards mama bear comes back in.
Example, I was working with a couple and um, one of the couples had done an ayahuasca journey and shortly after that did a bufo or frog journey. And some of the issue or the parts we were working with in the couple was that parts that had strategies which shut him down to intimacy a lot. So that was Mama Bear shutting intimacy is not safe, and his wife, she very much in the other, wanting to have more emotional connection and intimacy with him. And so he does these journeys, and I'm actually I was unaware he was doing them, and then comes back into the next session with his wife, and she's just beside herself, completely full. Not only let me back up. So when he tells me about the journey, I guess it's 2 sessions, comes back, tells me that his experiencing is so open, so wonderful, so self energy, just all those things that had been a trigger to him and anxiousness shut him down were gone. And so the backlash was now in relation. So Mama Bear came back in pretty pissed and really hard. And his part, so he comes back with his Mama Bear really pissed, and now he's projecting that onto his partner, his wife, and basically he wants nothing to do with it. So, and so that was what it looks like if you don't do the parts work prior to the medicine. You may be fine, maybe more often than not you'll be fine, but there is that potential risk of upsetting a mama bear, a protector, and basically, not respecting the job she's been doing. And don't worry that you screwed up your kid. I mean, you're doing this work, and assuming you stay with it, the healing energy, the self energy as you liberate it, we're not getting it from outside, we're liberating what's already there, that will impact the children and the interactions with them. So that's sort of the meta understanding of that. And then very deliberately, there's, as you map out, discover some of the parts of your reactions, yelling at the child, whatever it is, you'll be able to be more of an observer to that part doing it and be able to shift it more and bring more compassion to your child, yourself, your own children, which translates to your biological children. I mean, this is all the short response.
Yeah.
Just tagging on to the end of that, you talked earlier about ancestral healing.
Yeah.
Healing those wounds, the same thing. People are taught with healings, they say 7 generations back and 7 generations forward. So, healing the past, which is going everything forward, because you're removing that, you're removing those wounds.
Yeah. Removing and also inviting in when an ancestral legacy of burden has been unburdened, there's an extraordinary, mysterious, energetic space, and then we invite into that space whatever quality or even a guide, and it supports to support you and all the living relations that held us, and and all the ancestors, because in whatever miracle they're alive in an alternate reality right on your shoulder. It's not something that happened a long time ago. It's alive now, not just epigenetically, not just because your father had this voice, you have the same intonations. No, it's this real reality that the ancestors are asking for our help to help them heal. So that's getting more into a transpersonal awareness a little bit, but medicine journeys and transpersonal, yes.
Yeah. Do you have a question?
Yeah, I'm curious, since consent is such a big part of, utilizing psychedelics, and we have all these parts, like, how do you negotiate consent? Do all parts need to consent to a journey? And how do you sort of contract with the parts that maybe are not on board?
Personally, I would advise a person not to go until they're all on board. And then we get them on board. And I'm not the one judging how long or short that takes. It doesn't usually. If it's taking a long time, then you really do want to hold off. Because there's something there that's really worried
Yeah.
or something.
I also,
And then he has different experiences.
yeah, I might encourage actually microdosing and starting to develop a relationship with the medicine that you're going to use, so that your parts can begin to get a sense of how they relate to that medicine, and that what the work that you're doing on that medicine is healing and helps them do the job that they don't like doing less. And then you're beginning to set the stage. I think, I think knowing that also ketamine is incredibly safe physiologically helps put a lot of my parts at ease. And so knowing some of the pharmacology and the physiological effects of any given psychedelic, whether or not overdosing is possible, whether or not how you're going to deal with they talk about neuroplasticity a lot of times only as a good thing, but really it's just a bunch of new neural networks, and some of those neural networks are not necessarily networks that you want to keep. And so the pruning process is incredibly important. And that's both where you get to ideally decide on not running the same program you ran before, but also when you decide, oh, that paranoid experience I had on that trip was pointing to something else. So, for example, I had a trip and I had this paranoia that this guy I was working with was like into the dark web and had was doing some identity theft on me. And I had to sit with that afterwards for a while until I recognized that he was a friend of mine and there was a part of me that felt like I was engaging opportunistically with him in a business relationship because I wanted him to give me a good deal. And so it wasn't until I identified that I could come to him with humility and say, hey, he does psychedelics too, so I could share with him. I had this distrust and recognize that it actually had to do with a part of me that wanted to be getting a deal from you, and I just want to make sure that our business relationships aren't modeled with our friendship relations, and I want this to be a clean exchange. Does that make sense? How the integration process is very different than the paranoia I experienced in the trip itself.
I love these analogies. I'm sort of picturing like a school bus, and all your parts are on the bus, and whoever's driving is sort of kind of calling
So
where to go.
We use this analogy to say who's driving the bus. Right. And so many times it's some part, the drug part. It's, just using substances. You don't want that part driving the bus. And it honestly probably doesn't want to drive the bus either.
But how often they do grab the steering wheel and take over it and run it into a tree. So,
what's your question?
So how do you know when your parts have given you permission?
Well, you ask them. And you check into your nervous system and start to see are some of these qualities of self-leadership there. So if you've asked your parts, sometimes other parts get in the way and create a blockage or basically disassociation. So we don't really get an answer at all. But then the question is to check in: is there numbness? Is there some quality of deadening or some sensation in your body that suggests that there isn't a clear answer? And then to be cautious of that.
So many
you'll feel yourself relax.
Yeah.
Well, you feel that part like a deep breath. It's so good.
When people talk about like pre-journey jitter, it's being really natural, like there's that nervousness or journey, so you know you're about to engage in a significant process. So how do you tell the difference between normal, natural, like you're about to sit down on a roller coaster, there's gonna be some nervous jitters, versus hearts telling you we're nervous, we're a little too scared, we don't really want you to kind of separate.
So you interview the parts and see like, okay, let's just say it was you and I was here and helping with this, and then I just ask, okay, what part needs to be heard from right now? And probably always here's some kind of response. Or maybe a very literal, logical one, it could be something that makes no sense, a connection, it could be a smell, taste, or anything. But there will be a response. And then you explore it with curiosity, get to know it, and see if it's what it needs to be okay. And then, so that's it. And then if there are jitters and no part shows up and you've done a good interview assessment, then, you know, on with it.
And I might get from Michael, I'm sure other people here have their own experiences that the jitters are so common because we are stepping in the unknown. That one strategy is to, invite parts to get to a safe place. A strategy within IFS is to ask parts to give us space so that we can get to know a part. But likewise, you can invite a part to find its place of safety before you goodbye.
Yeah.
And again, I think this is where the microdosing can help one develop the relationship so that you're clearer about, there are parts that are afraid of the unknown, and yet the unknown is where our lives comes from. Yeah.
Is this something that would be done with a series of journeys, or sometimes maybe just one, or just depending on the individual or involved, or
Which part when you say would this be done with?
the part works and utilizing the
Yeah, we do it. I end up using it on myself throughout the day.
Well, I mean, like if you're a practitioner working with somebody.
Oh yeah.
Yeah.
I mean, generally, I guess it depends on how deep the person wants to go, and obviously, a lot of times, cost is a barrier to access to care, and so ideally, it's ongoing. But if you can only do one journey, then begin there, and ideally, the preparation helps set you up for success during your journey.
I just want to quickly add, Frank Anderson wrote a great book. It's called Transcending Trauma. And he talked a lot about, he's a doctor, and he's talked a lot about how contracting before prescribing medication, he's not talking about psychedelics, but it can certainly be applied, like contracting with the protective parts beforehand, and kind of assessing their fears and addressing their fears, and then asking them to unblend can actually predict better outcomes with the medication itself. And I've definitely experienced this with ketamine sometimes, both in my own system and with clients, where sometimes there will be a part that's actually blocking the medicine experience. And so, someone will say, well, I don't feel anything. And many times it's a protective part. And if you take the time to really befriend those parts beforehand, not only I think is it more humane and overall in integrity.
Sure.
It can really actually help people have better outcomes and less backlash afterwards too in the system from what the protectors are talking about, how sometimes the medicines can unblend these highly intense protective parts, but then the wound can flood later and there can be a lot of backlash. But if you contract prior to, then it can really help generally with that whole process too. So I think it's a really important topic. It's this topic it's called Transcending Trauma.
Yeah.
I think he talks about it in there, but You can look him up, Frank Anderson. He talks about that a fair amount.
You can probably also get some of the clip notes on YouTube. Reading that.
I'm sure, yeah.
And another flavor is like an example, not with hallucinogenics per se, but client is going to court for a divorce, and her parts are pretty triggered in some ways, and just works at least half the time by asking the parts if they would rather be somewhere else. They don't have to come to court. And they can go to the swing set, whatever it is, and just contract that you'll be back afterwards to pick them up, don't leave them there.
There's one other side that we haven't talked about, which is the grandiosity that can come with psychedelics, and the value of if them to really bring more of the self energy in to help bring that grandiosity to a place where it can get integrated into your life. And so, I don't know if you know the therapist Terry Real, but he talks a lot about basically how grandiosity and shame are part of the same coin. And so there's this analogy that grandiosity is like the difference between if someone steps into an elevator and they're feeling claustrophobic because of all the people that are in there. That would be like shame. And so they get scared, they turn green, and they get out. Someone with grandiosity steps into the elevator and they light up a cigar. And everybody else around them turns green. And so grandiosity hurts the people around us. And so it's really important when we start taking psychedelics to begin to flag this expansiveness as something to get to know rather than something to take action on right after that.
That's good.
Mm-hmm. Maybe a parallel, sort of, is when somebody doesn't do their anger, you have to do it for them.
Yeah.
And so there's some parallel there.
Would you say more about that?
Which one?
Like just like in Hart's language, like with that's like working with grandiosity. Yeah, like as a practitioner in general, or
well, so as a practitioner, I flag that there's an expansiveness that actually that I've come to see as fragile, and therefore I believe there's a good chance that could lead to a sense of shame. Actually, that the grandiosity is fragile and could go to a sense of shame. So the idea is, how can I integrate some part of that grandiosity? So, for example, having an experience that I am God. Pretty common experience on psychedelics. How do we integrate that? Well, we begin to ask, what does that mean to be God? And if we really take inquiry far enough, I think most of us find that to be God means that I'm lovable just the way I am. And so how can we bring that grandiosity into a place of real confidence and the 8 C's again? Yeah.
A couple of things. Humility, being humble, that comes to mind as a salve for maybe grandiosity. And also, as the time runs out, I was wondering how one would pursue this further.
Great. So there's a veterans table that actually has, I think it just says veterans group work, but I'm starting group, like a clinic without walls, to do group therapy, because I really believe that group work is how we're going to get access to care. I also think that while these medicines are amazing, it's the relationships and being a community, which is the real medicine. And that boundaries are crucial to us integrating that medicine. And so the point of this table is you can take a QR code off of it and scan that, and it's going to give a little bit about the groups, but you can give your contact information there. And that'll go to me, and then as we're forming these groups, with a little bit of the information you provide, I can give you offerings for ideally groups that have some commonality, because commonality is where we begin to develop a sense of safety and a sense of belonging, and then that creates a sense of willingness to be vulnerable, and vulnerability is where the healing enters.
Yeah.
Yeah. Any other questions coming up? Okay. Yeah. Anyway, we'll get your vote.
I think it's good. I just want like a basic understanding, like with using psychedelics in this process, are you doing the IFS process with this process of psychedelics in like different
100%.
degrees, but you're talking to someone and doing the training, like
I mean, I'm often doing IFS during the integration. So often
Right.
Mars are still alive in the integration or in the preparation. And I guess to me, there's two phases of preparation. There's preparation days beforehand, and then there's preparation right in the moment. And that, that preparation both can include IFS, but one's a little bit more immediate to the journey itself.
Sure.
And then coming out of the journey, I believe I really like to do the integration, some integration while the person is still under the experience of the medicine, rather than just days afterwards. I think there's a liminal period there that we can help to really direct the neural pathways that we want to reinforce. Yeah.
Can you just talk a second about the specifics of the microdosing ketamine and the dosage, and then how long for a period are you doing this? Like, we totally feel the tendency towards that to become a crush of sorts, and then when and how do you decide to come off of it?
Great. So it depends on your route of administration, whether or not if you're doing microdosing, you're doing it at home with medicine, so you're either going to do sublingual or nasal spray. The nasal spray has a higher rate of absorption and quicker onset. And the lozenges, I think, would be better if you don't want to have any perceptual shifts from it, to do it at night. If you don't get insomnia, then you're doing 25 to as much as 100 milligrams. And then with the nasal spray, I forget how much spray the atomizers create, but I would say 1 to 3 sprays. And
Depending on the potency of the
atomizer,
concentration.
And so there are people that have been using the microdosing for literally years. And there's a company that has started this, and it's called Joyous. And they're a tech company, they're not clinicians. And so I feel like I would want to be cautious. They're good at getting people medicine, not necessarily good at tracking what people's needs are. They're using tech to try to do all that, and they're missing things and consent. And so it's not therapy. It's a tech company that believes that they're altruistically oriented, but aren't necessarily providing the support necessary to do it, I think, safely. But it's a way to get medicine if you can create the safety and context in your community and for yourself.
And since you're not going obviously for the psychedelic effect there. Even though people have been on it for years, they might stay at the same 25.
Yeah. And I would encourage people with any medication or medicine to give periods of time without it, because by having it in your system, if you've integrated the knowledge you need, which again, is on some level a loosening of our attachments or a loosening of our blending with these parts. Yeah.
And just to piggyback on that real quick, were you suggesting like microdosing, especially for parts, doing this at nighttime, especially for parts that might feel nervous about the medicine? I thought I heard you say that.
I did say that for parts that feel nervous about medicine, I recommend practicing microdosing to develop a relationship with whether or not any psychedelic. It wouldn't have to be at night. If you're really trying to get to a journey dose, I would actually encourage you not to do it at night, so that you can begin to feel what the perceptual experience is like. The other thing that you'll find is, I have found that when you use these medicines to journal, with enough practice, you can actually get the same results on microdoses or smaller doses, and then you're still getting very perceptual shifts. But like I can do a microdose of ketamine and have a full blown journey if I attended a set. So that's where the setting comes in, and that's where community and transparency and all these other things are going to show us where the real medicine lies in the relationship. Yeah. I'm aware of the time, and that there's something else at 3. And so I also just really want to give gratitude for how much you joined me in the initial moment, and the sense of self that I felt present in that process. I intended to offer a guided meditation to do that, and so I just wanted to invite you to anchor into that initial experience of us all being starlings together for a moment.
You know, Om.
Thanks, everybody.
Yeah.